Introduction to Tree of My Life Visual History System. Now, just for a little bit of context, past medical history can be challenging, especially in lifestyle medicine. It's often fairly inefficient and in traditional medicine often doesn't contribute that much to care. And yet the science shows that especially for lifestyle medicine issues and behavior change, there are many factors and forces potentially identifiable in the history that are very important and clinically relevant. This can be things like ACE scores, epigenetic issues, socioeconomic status, social and physical environment growing up. Now, I've done more extensive history intakes with patients for many years. Standard format, text, check boxes, fill in the blanks, and so forth. It's been good, it's been useful. What we need to get to is a patient-centric history with the most pertinent aspects. We need it as visual or graphical as possible to be totally functional while being very efficient as much as we possibly can. Now, a psychiatrist in our local lifestyle medicine professional group was sharing with me his approach to patient care. And he shared this concept, this system or tool that he uses of a history tree. And he shared how useful it was, especially with the most deeply disturbed mental health patients. These are people that are locked up, incarcerated, if you will, due to their mental health conditions. Light bulb goes on. We need something like this for lifestyle medicine and potentially for beyond lifestyle medicine. So how could we turn this very patient-centric, useful concept into a fairly universal practice tool for healthcare? And again, especially lifestyle medicine, that is more focused on the change process. So we did some research on the internet. We found that there's a spectrum of variations out there on the tree concept for health, none that were seeming that close to what seemed to be the ideal clinical use. So how would we go about designing this? We want a system or a framework that allows you to do quick and basic or deep and detailed, should you need to or have the time to. It should address physical, medically relevant issues, as well as the psychosocial, emotional, spiritual, formative issues that are so important for behavior change, understanding where people have come from. It should incorporate the science showing the impact of 1 to 3 generations of ancestry, be that epigenetic, cultural, environmental, however those are working through whatever mechanisms, we want to understand that ancestral context. It should incorporate the prenatal and perinatal influences. Of course, it should incorporate the formative childhood phase, the adverse childhood experiences, socioeconomic status, and so forth. It should incorporate the formative phase of adolescence and early adulthood, as a person is really becoming their own individual. And of course, the present status, health conditions, dynamics, what's going on right now. And in this context of timeline, those would be essentially the fruit and the leaves in the present context. This looks something like this. We call it Tree of My Life. Note the left to right timeline sort of orientation or visual, if you will. You see the origins and the phases of life. You see impact from other who's, other people during those phases of life. And then when you get this basically done both through patient contribution and or provider guidance to get what's relevant to both the patient and the provider, rotate it counterclockwise 90 degrees and voila, you have a tree. And people intuitively get the concept of the tree. They can see how the roots have led to what has come up the trunk and why they're ending up where they are. This is very visually impactful. It gives people a lot of insight of what has led them to this present state. They're not just a loser, they're not just bad people, they're not just a big mess up. There's reasons they have gotten to where they are. Now, key point, this needs to be done in a supportive context for insight, not for judgment. This is to provide understanding in the context of support and acceptance. It's also really important in this to understand that the vast majority of quote-unquote bad behaviors are best understood as adaptive behaviors. People have done these things to cope, to manage, to feel better at different points in time with different challenges. No one sat down and said, I think I'm just going to blow up my life and make a mess of things. So the supportive context is extremely important. It also then allows people to stop beating up on themselves, stop blaming themselves. It potentially gives them hope for the future. They can start to see what happened and then potentially what they could do differently, what forces could be different to help them on their journey where they want to go. They can then also choose how they will relate to those previous persons and forces and potentially change that relationship, change that impact on them and their life. And as this is done, things that will feel fairly vulnerable, potentially, someone else seeing the ugliness of their life, if that's done in the context of genuine caring, genuine acceptance and empowerment, that's where people really connect. That's where empowerment really happens. The science shows that a genuine, caring, accepting, supportive relationship is one of the most powerful healing therapies that there is. Use that based on evidence for the benefit of your patients. We give you the Tree of My Life visual history system for the most efficient and impactful lifestyle change patient care. Use it in combination with the other models and systems and in the context of the universal purpose of human existence for best results.